Dear viewers, welcome you to the today's session. It is part of PGDCOUN program, and today's topic is substance abuse and counseling. Most of the social work students from graduation level, post-graduation level, and PhD, they are all very much aware the social work application in various settings, especially in hospital setting. And in hospital setting, the very important the counseling or specific specialization, or we can say specific intervention for social workers or counselors, it is substance abuse area. Substance abuse area is not a very simple, still it is a very complicated area, and it required various techniques and special training to deal with people with substance abuse. Substance abuse just not a one drug, it includes many drugs. So I am going to explain today. So what are the substance abuses can be seen in our country, and what is the counseling we can do with them. It could be individual counseling, it could be family counseling, and it could be community interventions. Now let's understand what is substance and different aspects of substance and the reasons and the impact, then treatment. In treatment, predominantly we are going to talk on psychosocial management. It includes individual counseling, family counseling, and other aspects. Now, so what is substance or the drug? In a simple understanding, a drug is any substance that alters the mood and body functions of an individual. Any drug, any substance, it could be alcohol, it could be cannabis. ये cannabis के हिंदी में भांग भी बोलता है, और marijuana. It could be tobacco, or it could be some probably medical prescribed drugs. Any drug, if you can, while using it, it can alter the functions of mind and body. That is a drug. Now let's understand what are the legal drugs are there. Mainly there are of course if you can categorize all these drugs into two groups, one is legal drugs, another one is illegal drugs. So there are legal drugs in our country, predominantly alcohol, sharab bolta hai, different types of alcohol is there. So alcohol is a legally permitted drug or substance that can be purchased and that can be used in our country as far as the Indian law is concerned. Then tobacco is available in the two forms, both smoking and chewing. So tambak wo bolta hai. Another one is there are solvents are there, and medically prescribed drugs are there, like cough syrup, painkillers, and sleeping pills. All these things are there. And another one is illegal drug. So illegal matlab our Indian law has not given the permission to use as well as to sell or grow these particular drugs in our country. For example, cannabis, so marijuana bolta hai, or bong, and apart from cannabis, cocaine is there, and there are a number of other drugs are there. Heroin, brown sugar, all of them are part of illegal drugs. And another very important is, like, of course, prescribed drugs is also part of legal drugs. They are prescribed for particular medical reason, but people may use it for their addiction or some other purpose, like cough syrups, painkillers, other things and all. So next, so very important the question is here, when social workers working as counselors or welfare officers, mainly the counselors in hospital setting, NGO setting, or consultant setting, or even in de-addiction centers. So we need to assess the individuals with the substances. Why do they take it? So reasons need to be pointed out. So it is a part of clinical intake. Whenever you deal with individual with the substances, predominantly you need to assess them, what kind of drug they are taking it, and why they are taking it, where they are taking it. So all of them WO questions are part of intake. We say it is a part of intake for pharma. So in that we need to assess why they are taking it. Each individual has got its own reason. So each individual has to say how he started, where he started, and when started, with whom started. So all those things are part of our assessment. Through this assessment, we will also get into some kind of probably impression, and we will find out various intervention targets. So it's all part of our counseling. Assessment is also part of a counseling. Through assessment, individually we can tailor made their interventions. So many people, as far as the literature is concerned, as far as the intervention, intervention methods are concerned, or randomized control trial, or n number of studies are concerned, there are n number of reasons why do people use these substances. So predominantly peer pressure. So we will discuss. I am going to show you some pictures so that you can understand this. So the main reason for using alcohol or any kind of drugs or substances, peer pressure. In the society, generally people will have their own friends, their own groups, or their own probably category, or what I could say peers. So they will observe them, or they will learn from them, or sometimes the friends force them, or they will influence them. So this is how generally people with substance do use, or they get into exposure for alcohol or any kind of drugs. The second reason is curiosity. So you can see this picture. Many times the picture gives you the clear message. Curiosity is another reason why people do use substances. So initially you may not be having any kind of urge, any kind of intention, but when you see some posters, or when you see people with alcohol or nicotine, any drugs, you may, for at least in your mind, you will get some kind of curiosity, thinking that okay, so let me try this, how this could be, or how this will affect my mood. People are using it, log use kar raha hai, sharab pee raha hai, they are using all kind of drugs, so let me also use it. So this kind of curiosity will be there in your mind, and sometime without thinking pros and cons or the negative impact of these drugs, you will have to, sometimes you will get into this kind of substances addiction. So that is another reason. The third reason could be imitation or modeling. This is again based on social learning theory by Albert Bandura. If you can read his theory, is very very clearly explained how this theory, how this modeling or imitation can influence a person to use any kind of substances or any kind of probably the behavior. So here generally, if you can understand how the countryside or how the village side, the families will use these substances, by looking at these families or parents in the villages, the children also will observe. For an example, a father generally he will be working, he is doing a lot of manual work, and he comes in the late night, and while coming he takes alcohol. He will be in a different mode, and he will be his speech will be blur. He will be having like shaky hands, or he will not be having balance while talking and walking. So generally the wife can identify that he has taken alcohol. So there will be conversation between these two, wife and husband, whereas the son or the children will be sitting at home and doing homework, and they will be observing, and wife asks, so why did you take alcohol? He says, from morning to evening I had worked, and I have got multiple body pains, and this is a kind of tonic for me. If I drink, this body pain will come down. So this is a kind of kind of conversation. Whereas in the corner, the children will be observing the conversation of the parents, and the children will think that okay, this is the tonic for body pains or any kind of body aches. So they will be also imagining the same thing. In case in the future, if they do same work, what if father is doing like manual work or land work and all. So if I get the pain, so I should also take the same kind of tonic. So this is a kind of imitation. So later when they get into this kind of work, and they will also imagine, okay, my father was taking this drug, so let me also take it. It will be a kind of tonic and my pain can be reduced. So this is how another group of people in the society do use drugs for various pain or kind of different kind of body related or even mind related. They can say that it's a kind of management or a kind of tonic. So another reason could be like there are a number of myths and misconceptions towards any kind of drug or substances. Generally in our society there are different kind of myths and misconceptions. Because of these myths and misconceptions, many people do use substances, and may they think that it is it's good for them, and by doing smoking or weed or drugs, it will be good for their mind, they could be good for their business, or it will be good for their loss of certain things, or even for body. So let's think what are the common myths and misconceptions in our society as far as the substance use are concerned. The main substances are like alcohol warms the body or cures the cold. So many times the people think that, okay, it is a winter season, so let me take alcohol, my body will be warm. So it is a kind of very myth, and very generally we can see because of this myth many people do use it, and later they'll get into addiction. Increases sexual desire and ability. So many youngsters do believe that if I drink or if I smoke nicotine, or if I smoke weed, or if I take any other drugs, my sexual function will be increased. So this is another myth. People are friendlier when they are drugged. So this is another reason. So generally, if you take alcohol or any drugs, and you will be very friendly, so let you, you can take it. So this is another kind of a myth. Limited amount is not harmful. So another, if you can assess these kind of people, they say that small amount thoda chalega, matlab small amount of alcohol, small amount of cannabis or weed or nicotine is fine. So and slowly what they do it, slowly they'll get into they keep on increasing their amount, and it will be a kind of addiction. So this is another harm. Even small amount of alcohol or cannabis or any kind of drug is not good for the health. It's like poison. In the poison, whether a small amount is good or big amount is bad. It's not like that. Even small amount of the poison is not good for the health. It's bad for the health, and it helps in concentration. So many children or students, when I do ask them or assess them as part of clinical counseling, based on my previous experience, many youngsters and when they were students, they do say that I'll have to study all night, and I have examination in 1 month or 2 months. So many people ask me to drink or smoke so that I'll have better concentration. So this is another myth. We should understand that definitely any kind of substance abuse or substance use will not increase concentration or even attention. Rather it will destroy all your higher cognitive functions and relieves pain. So many people say that I have got a wound, or I am in a sad mood, or I am not well. So to overcome this thing, let me drink, let me smoke, or let me use this drug. In fact, for that moment you will not be in the conscious. So later, once the drug level or drug, the power comes down, definitely you will have to face the same issue. So it is not going to cure, it is not going to reduce your pain. Rather, for certain amount it will black, or you will be in unconscious, and it will continue the same thing after that. So I'm going to show some pictures so that each myth and misconception you can understand in a better way. So these are all the pictures for like a peer pressure. So you can different whatever we have discussed, all those things are there. Now, so what are the commonly abused drugs or substances in our country? Alcohol is there, cannabis, opioid, and caffeine, solvents, all those things are there. And when does it become a problem? So see, initially definitely it will not be a problem, and when you slowly increase it, there are a number of criteria to say that you are in a problematic stage, or you are in addiction stage, or you are in a very bad state. You need definitely a treatment. It includes medical and psychological or even psychosocial. So there are a number of criteria to say that you are in the addiction stage. First one is a loss of control. That is I'm going to explain one by one. Tolerance, craving, loss of control with the pictures. You can see that the picture is first one is a tolerance. it will be, in the sense, initially you will have to take a small amount, and slowly it will be, the amount will be increasing. That means you will have a, you can probably, by taking more amount, you're going to get a kick. Otherwise, it will be difficult. So your amount of the alcohol or cannabis, any drug, will be keep on increasing. The second factor is a craving. You need more and more. So you will not be satisfied with the low amount. It keep on increasing. Third one, loss of control. So when you drink it, when you smoke it heavily or excessively, you will not be able to balance it, or you will not be able to control certain things. In the sense, you will lose your control. So all these three are part of criteria to say that you need treatment, or you are in a control, or you are in addiction stage. There are other criteria like withdrawal symptoms. So your hands will be always will be shaky or tremors, and you will have a your speech will not be in a proper condition, and you will have to, irritability is there, sleep deprivation or sleep related issues are there, anxiety will be seen, or aggressive behaviors will be seen. So all those things are part of withdrawal symptoms. That is also sign of addiction, that is a sign of dependency level. Salience, again, this is another factor for saying that you are in a last stage of addiction, or it's probably you may need the treatment. So what are the main the effects of any substance? It includes legal or illegal or medically prescribed drugs. For example, let's understanding alcohol. You can see this picture. So each and every part of your body is affected with alcohol. So that means alcohol is not good for health. Even small amount alcohol is not good for the health. Definitely every part of your body is getting affected. So when we are counseling the individual with the substances or the families, you need to explain them. While assessing, you definitely will understand what kind of drug he was using, when he was using, with whom he was using, how much money he was spending. So all those things part of your intake, and later you will have to explain them by showing it different the pictures and even their investigations. Many times liver function test will be there, and the brain CT scan, MRI also we do it. And many times you will have to show their blood tests and all. It includes sugar test, different tests and all. So all those things are part of the negative impact on their mind because of alcohol. So this picture tells you that exact the side effects are excessive usage, because of excessive usage. So what kind of medical issues they have found. So apart from that, there are a number of other negative impact of excessively using abusing drugs. Financial related issues I am going to explain one by one, and social issues, family related, occupational, and legal issues. So medically, these are all the part of body are affected with substances, and of course this is because of excessive smoking. So again, your part will be your body. Some people will have their mouth related issues. They will have cancer. They will have lungs related issues, and they will have different kind of health issues they will find. See, nicotine addiction means not just chewing, even smoking is also part of that. So many times chewing and smoking, so both will have a very drastic or negative, severely affected it affects severely to their body. So this is another part of picture, so that you can understand how their body is getting affected because of nicotine and nicotine usage. So this is like you can see that when people are chewing very excessively, their the tongue, their teeth, and their mouth is again getting affected. Some people will have cancer, some people will have wounds, ulcers, different kind of issues they will have it. So because of excessively usage of tobacco and marijuana, different kind of products. This is a part of tongue cancer because of excessively usage of tobacco products and other substances. You can see that very common. We can see this kind of issues in hospitals, medical centers, and because of excessively usage of substances. And very important, I wanted to inform you, when you watch any movie, you will initially you will find a kind of ad showing that excessive causage of smoking and nicotines will cause health issues. So that is very commonly every it probably government hospitals, they do promote this kind of health issues related ads, and even they do a lot of awareness programs, not just in the movies, even outside also they do it in as part of their health promotion activities. So this is a long filter with tar. So because of excessive smoking of cigarette or BD or other cannabis, that's nothing but a bong. Their lungs will be getting affected, and their lungs, they will have a cancer, lung related issues, and they will have breathing problem, they will have asthma. All those things are very common. So when we are counseling in a hospital setting or counseling center or dedication center, we should able to explain all the individuals affected with the substance, say showing their their pictures, their investigation reports, the scan reports, or even others reports we can show them, so that they will understand that okay, if I use this thing, and my lungs also will be affected like this, my brain is also affected like this, and I may get BP or sugar or different kind of issues. So we, with scientific figures, scientific data, we should counsel them. You can see that this picture, one side is a normal lung, another side is affected lung. So there are a number of other like a negative impact because of substances. Another reason is financial complications. What will happen when people do use excessive drugs, probably alcohol, cannabis, or opioid drugs or any other drug? So they will have too much they were spending on drugs, and financial obligations not fulfilled. There are a number of responsible back at home, and borrowing money from others. Again, it will be very common. And selling personal articles of property. So all those things are very common when you don't have money, when you will have to spend a lot of money on their different kind of substance related addictions. So family, again, as we are aware that people using alcohol, substances, their family is getting affected. There will be quarrels, there will be violence, and there will be communication related issues. There will be no well-being at all, and there will be no welfare, no happiness. Every time you will be quarreling with the person with substances, the family will be completely, they will lose their happiness, and there will not be any kind of support for them at all. And this is another reason, social impact. Drink and drive is very common, quarrels are very common, and ultimately will be behind the bars. So occupation related issues are very common. You will not be able to perform any kind of activities, and will not be able to attend your job regularly. Absenteeism is also very common. Like this, there are a number of reasons why, a number of complications when they use any kind of substances. So simply we need to understand them that this will have no positivity, this will have no a pleasure in terms of goodness. So definitely it will resolve, it will not give any kind of happiness. So one should understand that substance will be a kind of poison. So we should there are a number of counseling, individual counseling, family counseling. It is part of craving management. It is a part of high risk management. It is part of how to change their mood. It's a part of motivation enhancement therapy. So all those things we should be able to teach them in a proper manner. And because of shortage of time, and just run through some slides so that you can understand. These are all part of drugs. So yeah, there is a medical treatment. So it's a part of detoxification and all. So we should be able to teach them. You can receive all these treatments in a hospital setting, detox centers, or even in like multi-center treatment center facilities. It is a step by step. There is a treatment, medical treatment. With that medical treatment, we can also provide psychosocial counseling. It is like with the individual, you can assess, you can provide treatment. And with the family also need to understand what is the problem their son, the relative is undergoing, and how the family can support them, how family can help them out. So the family plays a very crucial role in terms of recovery. Without family support, the treatment will not work properly. So, all the counselors, all the social workers, whenever you do this kind of counseling, you will have to ensure that family counseling is must and family support is must, and family should accept that their treatment works well with their support. So apart from this, we can also provide community interventions that will be in a community. We need to generate n number of awareness programs, so that the community can be very well informed the ill effects of substances and the various the negative effects. Otherwise, it will cause it will probably destroy entire the family, of course, after the family, community, and society. So there are a number of other intervention methods probably that can be discussed in the next session. Thank you.